Pioneers talk today with two really exciting guest speakers from Novartis, Dr. Lutz Hegemann and Christina Campus. We're very much looking forward to the conversation with the two of them to understand how Novartis is shaping its purpose and its social entrepreneurship journey in the next couple of years towards becoming a force for good or even becoming a more stronger force for good. So today, we are focusing on the transformation of companies through social entrepreneurship. As I mentioned, we'll have our two speakers talk with you in a second, and we're going to be having a session moderated by François Bonnici, our great partner in crime from the Schwab Foundation at the World Economic Forum for Unusual Pioneers, our program for social entrepreneurs. We'll also have the chance to actually network together and work together and meet each other. That's usually the point where you can unmute, you can put your cameras on and talk to the other exciting people in the room. And who knows, if you're lucky enough, maybe you're also going to land in a breakout room with Dr. Hegemann and Christina Campus, and you can have a chance to speak with them directly one-on-one. And then afterwards, we're going to present a little sneak preview of our cohort of the Unusual Pioneers program, which I'll talk about in a second here. And then we'll close with a Q&A. Before we start, a little house rules here for us during the session. As I said, it's a massive meeting, which means that we all need to have a bit of discipline to turn our mics off. You can keep your videos on to see everybody can see each other, but please stay on mute for the time being. Why are we doing this today? We've been seeing a lot of corporate pledges and corporate momentum towards becoming more purposeful and towards becoming climate neutral, towards becoming a more purpose-driven company. 2020 really was the year of these corporate pledges, but 2021 is really the year when we're starting to see, well, making that happen is actually more difficult than all of us expected. And I think a lot of companies are struggling at the moment on how to turn purpose into the corporations, how to put social innovation at the core of the business. We just see a few examples here from press releases that are seeing that, we're still point where we're enabled to actually push companies towards becoming that force for good. Corporate boards are not yet set up with the expertise that they need to actually follow through. And investors are also finding that the net zero pledges are actually not turning into short-term measurable targets and follow through. And there's one thing to criticize companies for it. The other view is really to see, well, how can these companies learn and how to make this happen? And that's a big question that we hear a lot of times when we speak with corporate leaders, that yes, I want to turn my company around. I want to actually contribute to all of these changes going on, but how do I do it? It's a massive tanker. It's a massive task to get that cultural change inside of the company done and actually turn my company to a net positive contributor towards people, planet, and society. And this is where really our human creativity comes in, where we need each individual within a company to make this happen. And this is why we're so excited about social entrepreneurs, people inside of companies that are acting as the fire souls, as one of the shareholders we had talked about on one of the major pension funds. So that the fire souls within a company that start to turn this pledge, this idea of we want to be more purpose driven, we want to contribute to people in society, turn it into real action and make it tangible, not just for the outside world, but also for other people within the company to really lead by action and implement new ideas on how their company can be that force for good. So when we talk about social entrepreneurs, we talk about entrepreneurial employees of a company, but that act in a very entrepreneurial way and develop new products, services, business models, or partnership that create value for the many, for society, the planet, but also obviously for the company. So in that way, social entrepreneurs really help companies meet sustainability commitments and create value for a broad set of stakeholders that we're all looking for when we talk about the stakeholder economy. And we're going to hear very concretely and very precisely on how this is actually happening at one of the companies that is leading a charge here with Novartis. We've taken it on ourselves to look at the challenges that these entrepreneurs face as well. It's not just an easy road and an easy sail, and not everybody gets excited about change. So we looked at the challenges that the entrepreneurs actually face. And you can see that the biggest challenge here is corporate structures. So, fighting the corporate immune system that has been trimmed towards shareholder value for years and years and years, and now has to look at, well, how do we balance the interests of different stakeholders? But at the same time, it's also difficult to create a business case, because we all see and we all know that social innovation has really a hybrid business case out of not just financial results, but also employee engagement, innovation, brand and culture. So a lot of factors that come into the business case for a company, but that are not as easily measured. And so with these challenges, we said, well, how can we support social entrepreneurs? How can we support the sector to put the topic much more on the radar? And this is where the Unusual Pioneer program was born. That's why we're having our conversation today. A global support platform for inspiring social entrepreneurs with a huge range of partners that we were able to secure. Schwab Foundation obviously being the key partner here in implementing this, but also leading partners in the sector like the League of Entrepreneurs, like Ashoka, like the Circle of Entrepreneurs, Business Fights Poverty, Impact Hub, a lot of great organizations that have been working in this space for years and now see the momentum for this and turn it around into real transformation. That program will host, starting in August, will host the entrepreneurs and support them to scale their impact and scale their initiatives, and end on the occasion of the annual meeting of the World Economic Forum in January to then look at, well, what have we achieved, and also integrate their initiatives into corporate strategy, which is why we've set up the Executive Circle, a parallel program that runs with all the executives in these companies to understand how do we use that momentum of social entrepreneurship and turn it into transformation, turn it into change at the organization, and not just keep it one little side project and side initiative. As I mentioned, this journey is already starting. You're going to meet and you're going to see a few of the entrepreneurs that we have actually selected for this first cohort. We're going to continue to announce many, many more entrepreneurs, but we're really, really glad that we were able to secure such a rich group of entrepreneurs. And that's going to then physically start on the occasion of the WEF annual meetings in August, all the way until January next year. So stay tuned for more updates from this program and platform. We're really excited to have you all in the room, and even more excited, obviously, also to have our speakers here present and give us a bit of an idea of how social entrepreneurship plays a role at Novartis. And with that, I'll hand over to Christina. Christina Campus leads global health, heads the integrated access programs and markets at Novartis, and is joining us today from Lisbon. Mm-hmm. Welcome, Christina.
Thank you, Daniel. Thank you, Unusual Pioneers, for the invitation to be here today and to share a bit of my experience. I'm thrilled to be part of this program and looking forward to learn a lot with all the entire community and the entrepreneurs already involved. So a bit of introduction about myself. My name is Christina Campus. I'm based in Portugal, or I'm based in Zoom or MS Teams or whatever. And I joined Novartis 16 years ago. I've worked for American companies, also in pharmaceutical sector and the consumer goods market. As a background, I'm a pharmacist. I did an MBA in a sabbatical year, and I did some R&D I did some research in human genetics when I tried or thought of becoming a scientist. And then I moved into more a corporate career in business. That was all my life in terms of management. For the last 8 years, I was a general manager for a pharma organization in Portugal and country president, as well as vice president for the local trade association and president for an alumni of an MBA, international MBA in Portugal. So I joined Global Health about 3 months ago, and I'm really thrilled, but also humbled to join this organization, which has a huge mission and a huge challenge ahead, a big responsibility and a big role for Novartis, but even a bigger role for the society, as we aim to really reach more patients and more underserved populations in order to help them access better healthcare, better quality of care in a more equitable way. So for me, in my experience, when I think about social entrepreneurship, I think it is definitely increasing importance as in many corporations, but definitely at Novartis. We have one of our strategic pillars is to trust, to build trust with society. And that gives a lot of direction and empowerment to the people at Novartis. And with the culture that we have now, an unbossed culture, we are all expected to be accountable to deliver on this promise as well. Two of our values are inspiration and curiosity, and both values are actually drivers of this culture, where we are moved with a purpose to improve people's lives and stay vigilant and open to learn with others and co-create to maximize impact. Today, people are driven more and more about purpose, more than actually looking to what they look at their work, and mainly the youngest generations, they are looking for to have a bigger role in society. They look to work for companies and for people that also aim to have a positive impact on society through their work. And so I see this more and more in the conversation I have with my with younger mentees, but also with my kids. I have 3 kids. And what I see is that they are more and more curious. They challenge a lot the traditional, the meaning of why we do what we do and for what. And so more and more I see them, the need that companies become more holistic in what they do beyond the only the business focus in terms of commercial KPIs and commercial achievements. When the pandemic arrived and reached all the countries across the world, and I was locked down at home for 3 months as a single mother with my 3 kids, I really felt that I wanted to become more relevant to a broader society. I was general manager at the time, so one of my main objectives was actually to be supporting the team that was all locked down. So we had a team of almost 500 people working from home, and our main aim was, of course, to keep their safety, physically speaking, but also their psychological safety. So that was my main purpose, was to be a servant for this huge team and their families, but also for the society. That was very clear and important for me when I really saw the vulnerability of so many populations in the country I'm living. And so I offered myself as a volunteer for my neighboring for my neighboring communities, and to help the elderly people that were at home. But I also worked from a professional perspective with governments and private stakeholders to create alternative channels to give access to patients that have no COVID, but they have no access to healthcare in Portugal, because usually they got their medications at hospitals, but hospitals were closed for patients. So we created alternative channels for product delivery at home or through community pharmacies. And we created online platforms. We worked with global health since the first day, including with Lutz, to look for how could we also support better the healthcare systems with equipments, with ventilators, but also with other types of support in terms of training, capabilities for patients to help patients cope with the pandemic, and so on and so forth. So this experience in the pandemic and in the lockdown actually influenced me a lot in my decision to move from a pure business commercial role into a more holistic role, where the P&L is really a triple P&L, not only focused on profit, but actually focused on the people, focused on the planet, focused on the society as a whole. And so I was very excited 3 months ago to join Global Health, because I do really believe that there's no sustainable health without a global effort. There is so much to be done at scale, so many great ideas to be scaled, so much collaboration, and we really need, and we see that with the vaccination, we really see the need to raise the competition across countries and societies into a more cooperative environment. So in this role, as you can see on the slide, I hope it's everyone can actually see the slide. In the role that I have now at Global Health, I'm leading a team, a newly created unit called Integrated Access Programs and Markets. And I'm working and building actually a team that is already driving a lot of social entrepreneurial programs that aim to broader access of underserved populations to better quality of care and addressing the major unmet public health needs, but also the major burden of disease in their countries and in their communities. This is not done in a silo way. It is done in an integrated manner in a big corporation like Novartis that aims to complete all the offerings, all the capabilities for a proper and sustainable operational model, which is both an opportunity, but as well as a challenge. So in this slide, maybe I could highlight the Healthy Family Program, which is a great example, in my opinion, of a social entrepreneurship. It's not based on donations. It used to be actually when it was created many years ago, but now it aims to be an innovative, a sustainable new way that combines both social and commercial business models. So the idea being that we move from a feeling good to a doing good, to all, for all, in a sustainable way. So this is in a nutshell a bit about me, the team, what we are trying to aim at Novartis, and I'm happy to engage in a dialogue and again, learn with everyone on the call, on the meeting, on this meeting. This is not a webinar, this is a meeting.
Thank you so much, Christina. That was a great intro, and thanks for the great work. I think you're up for an exciting journey, and we're looking forward to being part of that journey and also starting a conversation today. And with that, I'll directly hand over to François, who will lead our conversation between Christina and Dr. Hegemann, both from Novartis and both from, you've heard so far from Christina. François, over to you. And for those of you who haven't met François, apart from being a force of nature, he is also the head of social innovation at the World Economic Forum and the director of the Schwab Foundation, and looking forward to the conversation.
Thank you, Daniel, for the kind introduction. That force is only fueled by coffee. So welcome to everyone to this meeting. My father was a physician, and he started it by bringing me coffee every morning in bed, even while I was in high school. I was hugely spoiled, but followed in the footsteps of a great physician, and just delighted to welcome Dr. Hegemann. We connected just before this call, recognizing we've both been physicians in public health, and really wanted to bring him into and welcome him to this conversation together with Cristina. Because it's a meeting, also want to encourage those of you who are here with us to put questions or comments into the chat. I'm going to try to follow, and if there are those that are relevant to the conversation, I'll try to pick out one or two. Just to start with, Daniel, you mentioned I'm now working at the World Economic Forum and its sister organization, the Schwab Foundation. The Schwab Foundation has really been trying to advance the work of social innovators and social entrepreneurs for the last 20 years. And more recently recognize, this work has also been happening inside companies. And at the same time, for 50 years, the World Economic Forum has been driving the practice of, based on the theory of stakeholder capitalism. After 50 years of doing so, we had the annual meeting of the World Economic Forum last January, where it kind of felt like that was a moment where, after the Business Roundtable in the US, we'd come to a moment of recognizing we're beyond the era of pure shareholder capitalism. Novartis has been a long-standing strategic partner of the World Economic Forum, also recognized for its work in supporting social entrepreneurship, and has been essentially experimenting and had substantive initiatives over many years in creating access beyond the pure commercial sales of running a pharmaceutical company. So there's an important long history here, and I want to go back and ask Lutz to come in. He has a really interesting role where he oversees global health, the integration of ESG across the company, and corporate strategy, which I think is fascinating as a combination of portfolios. because of their synergy. And I'm going to come back to that, but let's go back. Let's to ask you to quickly introduce yourself, your background, your current role, and a little bit about the history of social entrepreneurship and your interactions with it within Novartis, as we now then also look forward to Cristina and this new important structure and initiative inside the company. Welcome.
Yeah, no, thanks very much, François, and thank you for having us today. It's great to be here and participate in this discussion. You had mentioned already quite a lot. I'm a physician like yourself by background, and then made the step into the private sector some 25 years ago. And I had the opportunity about 10 years ago when I moved into a different division and became responsible for a portfolio of about 150 medicines that were the main profit driver at the time of Novartis, the so-called established medicines portfolio, to sort of say, well, do I just want to maintain the status quo and use those medicines to retain the role that they are currently playing, or is there a possibility to redefine how we think about our portfolio and use innovations from the past to take them to communities that still need them the most? That was sort of a pivoting moment on my personal journey where I said, well, let's try this. As long as we don't jeopardize the existing business, maybe there is something that we can gain both from an impact and social, but also potentially a bit from a financial perspective. We started a very deliberate effort to bring those medicines to underserved patient populations. And this wasn't easy. There is, of course, technical challenges. There is regulatory challenges. There is a question, is this product fit for purpose in a resource-poor health setting? But through the work that the team and I were doing at the time, we got more and more buy-in and essentially started very small. And I liked your notion of experimenting. So that was an experiment, and we constantly had to redefine our approach here in order to make this impact. But I'm very grateful that I was given the space to experiment in this area. And now, sort of 10 years later, of course, the environment has significantly changed. The company's expectations have changed. Our leadership has changed in that we now have a CEO who is very purpose-driven, likewise a public health physician by background himself, and really wants to make sure that we understand and redefine the role that we as Novartis play in society, as Cristina already mentioned. I think particularly for a pharmaceutical company, of course, where ultimately our contribution has to be to the benefit of people's health and well-being, our purpose is somewhat inherently a social one, and we cannot rest to maximize the impact that we have through our work and through our portfolio.
Thanks, Lutz, and welcome back, Cristina. We lost you for a minute. Lutz was giving an overview of, I guess, where Novartis has come from and the work that he's played. You now lie at a really interesting intersection, Lutz, with kind of integrating the ESG strategy. We've spoken, for those of you who in the meeting who listened to a few of the previous Unusual Pioneer talks, we've spoken quite a lot about corporate intrapreneurship programs that run as a social business subsidiary or their own business unit. And we're really interested in how those start to influence broader corporate strategy. And you're also speaking about an external environment now, whether it's investors or customers or clients who are also interested in the environmental, social, and governance kind of priorities of a company. So speak to us a little bit around how this transition, what you've learned from your 10 years, and why this is setting up and designing, I guess, Cristina's role, but also more broadly, how that feeds into corporate strategy. This is going to bring a new set of challenges for you, but based on that experience.
Yeah, no, thanks for this. And I mean, 10 years ago, we, like many others, we sort of started addressing global health programs, which I would use sort of as the focus area for societal contribution of a pharmaceutical company. And of course, different sectors may define this very differently by running those sort of initiatives in parallel to the core business. And we started, like many others, with charitable donations. Then we sort of piloted around no loss models. Then we said, well, maybe a marginal profit is going to help invest into adjacent programs. And I would say we are still on a journey here. But what was a very important step for us as a company was in late 2017, when our CEO formulated what we call the Novartis Access Principles, where we say, how can we bring this thinking into our core business? How can we make sure that already at the R&D phase of new medicines, we take the broadest access possible and underserved patient population into account? How can we make sure we price our medicines in a way that pricing doesn't become a barrier to access? And then lastly, how can we make sure that we work with health systems so that they can make the maximum, or they can derive the maximum benefit out of medicine innovations for the communities they serve? And we regularly conduct what we call materiality assessments, and we are just in the midst of our fourth materiality assessment, where we are asking our stakeholders, and that includes investors, associates, business partners, NGOs, some governments, what are they expecting from us as Novartis? And that gives us a very clear North Star on what to focus on. And for us as a company, it's very clear it has to be the S in ESG. I mean, there's very clear expectation, of course, don't do damage, don't do harm to the environment, and behave ethically and have a good governance, but make your differentiation through the S part, and that is global health challenges like neglected diseases and access and affordability of your medicines, and make sure that as many patients as possible benefit from it. And this is now where we are bringing sort of the ESG thinking into the very core of our business, and we are at that step of now integrating this pretty much into everything that we do.
Thanks. I'm going to come back to you, and I want to speak about kind of the roles of other companies, because obviously one single company can't overcome all of these issues around access and equity alone. But to come to Cristina now, you've obviously been given an interesting new construct within which to build an integrated access programs and markets. We know from the research that Unusual Pioneers has done and the partners in this work that actually doing intrapreneurship is quite hard, and a lot of the barriers are internal. You've been given an opportunity here. What are you particularly excited about, and perhaps what do you see as some of the kind of challenges that you've got lying ahead?
So I'm very excited about the untapped opportunity, all the untapped opportunities. I think that, after managing the operations in a country that is developed, not the most developed, but developed, and launching so many innovative products and focusing so much on innovation, and then having to see that all the vulnerability that exists across the world, I see so many untapped opportunities. And this is what really excites me the most. Most of my touching experience in my life were actually working with vulnerable populations. I have had, as I've already said, I was a volunteer, namely when I was studying at the university. I was a volunteer for 5 years in fighting for HIV prevention. At the time, the second virus was discovered by a Portuguese scientist by coincidence, and we had a huge program to fight and prevent HIV spreading in Portugal. And this was one of the most touching experiences I had in my life, working with the most vulnerable populations. Also, another example was 3 years ago, I was traveling to Tanzania in Africa, and I was sitting by a lady, and she was quite, I would say, negative about Tanzania. At the time, she was from the north of Europe.
I think Christina's just freezing on us. She did warn us that her internet would be great, but she was giving some really useful and important examples. So I'm hoping she'll come back to us shortly. Lutz, are you still there with us?
Yes, indeed.
Yeah, perfect. Well, I'm hoping when she comes back, because there's some interesting questions in the chat also about youth. But Christina was starting to bring up this idea, and I wanted to come back to you, that some of these issues are, we have great inequity, and particularly in global health right now, in the middle of a pandemic, we all see the kind of challenges in vaccine equity that's, looks like it's going to be throughout 2021 and even into 2022. I'm not going to ask you about vaccines specifically, but it raises the point that even if you're, wildly successful in getting access to your products, but also in terms of looking at also barriers in health systems that you've also identified, more than just products. What is the responsibility of a company like Novartis to work with others? And so this is kind of Professor Klaus Schwab framing of stakeholder capitalism, not with business in the middle necessarily looking at stakeholders around them, but business being a stakeholder for our common goals, for our common objectives about a healthy society. So what else do we need to do? What else does a company need to do to help advocate for that equity and even change some of the rules of the system that a company like Novartis has to operate within?
Yeah, no, I think an excellent point, particularly as we now, as a consequence of the pandemic, see the inequity of health being exacerbated. And I think one of the places where we see it the most currently is in the United States, probably less so in Europe, where we have sort of a universal health coverage that is pretty much free of charge, or at least at a very predictable cost. And I think that we all have a role to play here in, first of all, defining very clearly the world that we would like to see. And at Novartis, we have put this into our mission statement, that we say it's not just good enough to innovate, but to make this innovation accessible to as many patients as possible. But then, as you said, of course, no private sector player can do this alone. So I would say first look for like-minded other private sector players. And one example you may be aware of is that at the last UN General Assembly, 16 innovative pharmaceutical companies, together with the Bill and Melinda Gates Foundation, issued a communique where they said whatever we innovate in the space of COVID needs to be accessible to everyone. And we'll use whatever we can, tiered pricing, all the way down to donations if appropriate, to make sure that as many patients as possible can benefit from this innovation, which was the first of its kind communique that was ever created. But it shows the ability to, as a private sector, move together and look beyond boundaries. And as some of you may know, we are currently supporting some of the vaccine manufacturers with our production capacity in order to increase the number of available vaccines. And I would hope that for other important challenges that we face as a society, we'll see this level of collaboration. But then we also need to take it beyond just the private sector. And we do this particularly in our health system strengthening programs in Africa, that we work very closely with local governments, that we work with NGOs, that we work with other societies, where we say, well, how can we define a shared vision, but then bring complementary skills to the table in order to have a broader impact? So to me, this has to be a team sport, and it's certainly not one single organization that is driving it, although sometimes you need someone to take the first step, to maybe do a seed investment, to use some convening power, convincing power, in order to sort of create the initial momentum. But it would be foolish to believe that you can do it all yourself with your only organization.
Thanks so much, Lutz. I'm going to pull on two questions from the chat here, and hoping Cristina can rejoin us shortly. We've learned a lot about that intrapreneurship requires an internal culture and some champions from the executive as well. And some of the questions here are trying to get a bit more practical also, and ask. Cristina referred to young people. What's necessary within a company to create that space to actually achieve these, ambitious objectives about being a purposeful company, what kind of culture do you need to create, and how are there any ways that you're supporting that internally? We've heard about Christina. What else, are there other examples you can give us? But also outside of the company, there are a lot of social entrepreneurs in this audience as well. Are there any concrete examples of partnerships with grassroots and with local social entrepreneurs who support perhaps some of these access programs? So 2 questions then. Welcome back, Christina. I was asking a question about supporting young people. You had referred to it yourself. How do we support the next generation of employees within companies to be part of this purposeful journey and bring their ideas to fruition? But also, how do you potentially partner with social entrepreneurs or local organizations as part of this?
Yeah, I think it is important that you create the space to do this. I believe that, and we've seen this now, that people are intrinsically motivated to do the right thing and really flourish if they have the ability to not do this outside of their day-to-day job, but bring it into their day-to-day job. And then the question becomes, how do you create a culture where this is not only permissible, but appreciated? And we've been a lot on a culture journey, as Christina had mentioned earlier, where we first of all say, well, everyone should bring their whole skill set into the company and should sort of foster curiosity, lifelong learning, experimenting, but then also the empowerment to be able to do certain things, challenge status quo, and so forth. So I think this cultural change has helped a lot to unleash the power of our people who intrinsically are very, very motivated to do something for a social cause. And then, of course, that also extends to the external environment, that you don't look at a large company or large enterprise as being a closed ecosystem, but that you look for opportunities to exchange with your environment. And particularly we see in the emerging markets in sub-Saharan Africa, but also in Asia Pacific, a huge level of creativity that I think we would be missing out tremendous opportunities if we weren't receptive.
Thanks. Christina, do you want to jump in there with either of those? And then I think I have time for just one more question.
I'm really sorry this happens.
No
right?
problem.
I mean, I missed the flow, but maybe I would like just to come back to the challenges. I don't know if you cover the challenges or the opportunities or whatever. I mean, I really feel that what Lutz just said about leveraging the power and the creativity and the entrepreneurial skills that we have within Novartis is really critical. And this was my experience in my previous job. We did a lot of open innovation, working with startups, with the society, with patient organizations, and this co-creation, this ability to create bridges with different stakeholders. It's an amazing source of innovation and a great engine to make things happen. So this is the power of Novartis and the culture we have now. It's really, I can only echo what I could listen from Lutz, and I see this environment in global health quite in an intense way, with even a plus, which is diversity of global health. We have people from across the world with different backgrounds, with different experiences, and this just is having the ability to make the inclusion of all this diversity and leverage all this diversity is definitely a plus. And I think you were mentioning that before I left, the need to create bridges also with other companies or with other and cooperate instead of compete in this space. I clearly see it's a big step, I think, and we see that already with the pandemic, with fighting the pandemic, with every effort that we are, even in global health, that we are doing in terms of producing vaccines for other companies and so on. This collaboration, this cooperation is just amazing, and that's the only way I see we can really move the needle and have an impact at scale that is sustainable. Even though Novartis is huge and is one of the biggest corporations in pharma, we cannot go alone. I think that's something we also know that, right? So
thanks, Christina. You both spoke about a bit about the scale and the sustainability, and going beyond, and you referred to this earlier, purely philanthropic endeavors, and how one of the questions on the chat was also wanting to know, just can you give us one quick example of a commercially successful program? They've asked, how does it compare to the P&L others in the company, which you may not want to share, but I think what's important is that, you know, so many individuals working in companies need to be able to demonstrate the kind of the, you know, the business case, and we've kind of discovered that. And I think Novartis has proven it over and over again that that's possible. This is why you're taking these more extensive steps. But maybe we haven't spoken concretely enough, so maybe give one concrete example, and then I'm going to hand back to Daniel because we'll have some breakouts.
Yeah, I mean, maybe one concrete example that is historic and has been published, so I'm very open to talk about it, is our Healthy Family program that Christina had also mentioned, where we've said, well, how can we reach rural populations in India that normally would not have access to healthcare with a combination of health education and some very basic interventions. And we didn't set out to sort of drive any profit from it, but the program broke even after 3 years, just because it was so very well received. And I think the key here was that there was an unmet need that no one really was interested in addressing. And that's how we got into it. And now I don't have the numbers, but it's very impressive how many patients we reach with this dual benefit of education and delivery of very low cost medicines, and that this can truly be possible. I think we have to reframe our business expectations in this field, and then it comes to what is your sort of the KPIs that drive your decision making. We've just pivoted in sub-Saharan Africa across all 45 countries to a new business model where we have said, well, we make our business decisions based on how many patients we can reach, and not based on how can we maximize the profit. We want this to be a profitable business, no doubt about it, but the mindset becomes different, that it's not about profit maximization, but it is about creating an impact, where the closest proxy that we use is how many patients do we reach. And the ability here to put this into action is tremendous. I mean, I've just seen, it's just been active for a year, and the data are all pointing in the right direction and making significant gains on patient reach, but also making some profit gains on the back of it, which is, again, not the main driver of why we do it and how we go about it.
Thank you so much, Lutz, for sharing both that history, but also, Cristina, the future ahead. Wanted to wish you both well, and thanks for coming today and sharing. Perhaps you can share some of those reports or data, you know, on the chat here if people want to learn more. And of course, we're going to go now and, you know, give you a sneak peek of the Unusual Pioneers program. Cristina, you know, being part of that, we hope will support you on, you know, on your journey. And to hand over to Daniel with the thanks.
Thanks so much, Francois. And thanks, Lutz and Cristina, for sharing all these insights that were super valuable. I think one thing you mentioned was definitely the necessity to cooperate between different players, between different organizations, companies all over the world to solve some of these challenges that we're facing. And that's really the spirit also of our Unusual Pioneers program, which you'll hear about what kind of companies are coming on for the 2021 cohort. But in the spirit of collaboration, we also wanted to give you now the opportunity to meet each other and potentially, as I said, win the lottery and also meet Lutz and Cristina on one of the breakout sessions. So we're gonna now go into that. We recommend you're gonna be in a room with a couple of people. We recommend to really keep it short on the intros, but right dive into questions, comments you have based on what you've just heard. Maybe your interest in social entrepreneurship, and right, get to the gist of it. Ruby will open up the breakout sessions now, so feel free to just click join, and we'll meet back here for a few more questions and conversations, and then leave you with the sneak preview of the Unusual Pioneers Program 2021. All right, over to you, Ruby. Let's kick us off into the breakouts. All right, you can see now that the host is requesting you to join a breakout room, and please follow that invitation to talk to some of the fellow people here in the room. It's random, so we haven't assigned anything. So you can only blame the technology, but we're looking forward to it. If you have any problems joining the breakout rooms, tell us here in the plenary and we will assign you as needed. To my great colleague, Rodrigo, who's going to walk us through 3 very concrete examples of the Unusual Pioneers program and how these social entrepreneurs are also turning their companies into a force for good. Rodrigo, over to you. I'll share my screen.
Thank you, Dan, and hello, everyone. Rodrigo here. Yeah, so I guess that my time is sharing a little bit of, our cohort. And so before going for that, I can tell you that it's been a very inspiring time with them, learning from them, and also understanding, their challenges and the things that are doing. So I would love to introduce a few of them today. We will continue reviewing applications and talking to corporate social entrepreneurs. So please, if you know anybody that is interested in Unusual Pioneers journey, please spread the word and share with them. So our first one is Godwin Banza. So a quick intro. Godwin is currently working in women empowerment, livelihood, and financial inclusion, and by providing business training and funding to women, micro-entrepreneurs in rural areas in Nigeria. So I would love Godwin to say hi to the community and to tell us a little bit of himself. Godwin?
Hi. And no, it's really a pleasure to meet everyone and to be accepted to this community. I have a background in public health nutrition, and I joined corporate. Along the line, I developed interest in sustainability and did quite a few projects, and eventually I now lead sustainability for the business. One project that we really love that has a lot of potential, as I was telling a few friends just now, is the Shakti program, which is a program which I have brought to the Unusual Pioneers work. And we take women in rural areas and we empower them, we create businesses for them. It is an idea with a really good idea until you get into the nitty-gritty and begin to see the challenges. So I'm there to see how much I can learn and how we can take this program to scale and achieve even much more. So thank you so much for accepting me, and I really look forward to the work to be done.
Thank you, Godwin, and we are really happy to have you on board. And our second Unusual Pioneer, it's Ruchika from States, and she has been working in a really, really nice concept that I would love her to walk us through, and she's a very energetic personality. So welcome, Ruchika.
Gee, with that introduction, Rodrigo, thank you. Hi, everyone. My name is Ruchika Singhal, and I'm here on behalf of Medtronic Labs, which is our social business initiative at Medtronic. We are developing solutions for chronic disease management for underserved communities, and really looking at, how do you integrate technology along with service delivery on the ground, and really through partnerships. So very excited to be part of this community. Thank you to the Unusual Pioneers team. And yeah, I'm looking forward to learning from everyone. It's great to see other like-minded, energetic folks who are all trying to drive change. So thank you.
Thank you, Ruchika. Happy to be working with you. And last but not least, it's Gisela from Costa Rica, and she's working in eradicating undernutrition in Central America and South America. Welcome, Gisela.
Hi, Rodrigo, and hi, everyone. Thank you so much for having me in this amazing program. I work for a food company here in Costa Rica named FIFCO. And 7 years ago, we decided to create Nutrivida, which is a social business. We produce fortified, highly nutritious food for people in need. And we hope we're gonna learn a lot from you guys and try to contribute to your initiatives. I'm here with my peer, Maria Pia Robles, and we're really, really excited to be part of and grateful to be part of this. So thank you so much.
Thank you very much, Gisela. And thank you for the three of you. You know, you made our interviews and sessions very exciting and very energetic. So we are really happy to have you. And over to you, Dan.
Thank you all. Thanks for sharing. I think that just sets us up for really exciting next steps here on the Unusual Pioneers front. Future events coming up. I just shared yet another great event and conference happening in June, the Global Entrepreneurship Week. We will be sharing more news about social entrepreneurship in the days and weeks to come. We're extremely excited to have Gisela, Rodrigo, and Godwin on the program. I can't wait to get this journey started, and all the best to all of you. Let's make change happen. Thanks again to Christina and Lutz for the insights today. All the best for the next steps, and talk to you soon. Have a good day, stay safe, stay healthy, and stay sane these days. Thank you.